Dr. Chandrakant Lahariya, at this moment, what are the lines of treatment? If, God forbid, somebody were to have suspected monkeypox, in terms of getting tested, what do they need to do? In terms of medicines, what are the medicines available? What kind of vaccines are there? Do we in India have access to those vaccines?
So what we know that monkeypox is largely self-limiting viral illness. So
what does that mean?
It means that usually symptoms are mild and person recover without any medication. So what is required, usually if person has a fever, then you manage the fever, or any other symptoms. If rashes are there, you just take care of rashes. What one need to worry if there are complications, and which complication could be any part of the body and including lungs, etc. So you have to take care of complications. So what happens, majority of patients recover usually in the longest period of 4 to 5 weeks, but they recover fully. And the example is that though in the non-endemic countries outside Africa, though around 15,500 cases have been, confirmed cases have been reported, but there has not been any death outside Africa. So this is a fairly self-limiting disease. Having said that, there are one medication, therapy tecovirimat, antiviral, which was originally developed for smallpox, has been approved against monkeypox, but again, this is available limited stock in a high-income country, European settings, and United States.
Do we have it in India?
To my knowledge, it is not available in India. It's only.
Should you think if the government is watching at this time, you would encourage them to start buying and stocking up on this antiviral?
I think this is what going to happen with both antivirals as well as vaccines, because there are a few vaccines also which have been given emergency use authorization in European settings and United States and Japan against the monkeypox. But again, those vaccines are not available in India. So once this is declared as a public health emergency of international concern, all countries, including India, should explore how to secure some stocks of the tecovirimat, the therapeutic, as well as that of the vaccine. Also, the National Vaccine Committee should be looking at that if vaccines, like how to procure the vaccine, and once vaccines are available, because those are irrespective of whether we have or not, are going to be limited stock, how to prioritize those vaccines. So definitely, even though
do any of the Indian companies manufacture these vaccines?
No, there is no Indian company which is manufacturing the vaccine, because this is only the second generation and third generation vaccine, which are really relatively advanced than the original vaccines which were used for smallpox eradication before 1980 were manufactured in India. So the second generation and third generation which are recommended for monkeypox are not available in India. But I am sure with this kind of public health emergency being declared at the global level, there would be collaboration, and that's what the focus should be, to procure and have a collaboration to produce vaccine in India, or if that is not immediately possible, then secure some stock.
Now, Harish Iyer, we saw how even some doctors are convinced that this is a sexually transmitted disease, even though genuine bona fide experts are saying it's not. Sexual transmission is one line in which the virus can be spread. There are multiple other ways, including close contact, droplets, bed linen coming in touch. Therefore, there are other ways in which monkeypox can spread as well. But the message that seems to have gone on, there's a lot of disinformation around this, and it's, in some senses it is true that largely it is spreading from intercourse between men. So there is A, misinformation, B, in part it is also true that monkeypox is largely spreading through men, even though that's not the only way in which it can spread, and therefore it almost certainly isn't a sexually transmitted disease.
Well, thank you first, Rahul, for speaking about this issue, because I think we should be proactive in speaking about these issues. Secondly, we also need to exercise caution when we speak about these issues, because this could lead to the demonization of an entire community of LGBT people. It is true that that the case history has been of people from the community, but we need to look at them as not as super spreaders, but as people who have been victimized, and it's been in that close population. We don't know if it spreads through intercourse, but it definitely spreads through close physical contact. So it could be a small population which has been affected, and this is the same thing. The same stigmatization is something that WHO warns us about as well in its press release. What it actually says is that this should not reach the levels of stigma. It's been an awareness drive from WHO, where they've said that it has been found in this community, and because this community is marginalized and we live in close proximity with each other. We could have partners in this community. It is spread in this community, so we need to be cautious about it. Also, we need to take lessons from the AIDS pandemic that we have had. It was called the it was called GRID at one point of time, and it was something called as a gay disease. But later on, we found out that it was not just homosexuals, but anyone, and there were many other modes of transmission. Same is the case over here. It's not a sexually transmitted disease. It is a disease where people come in close contact with each other and it spreads. And we need to fight against disinformation that could spread to epic proportions and stigmatization